Hi there, this is Lori Edge-Hughes, and this is your 4-Leg Rehab Minute. And in today's minute, I want to talk about the 4 pillars of rehabilitation. So, I looked at this when I was doing a a little mini class for the University of Calgary vet medicine students about rehabilitation. And I was kind of forced to lay it into one condensed thing as what is it and where does it come from and what are the principles. And one of the things I created was basically your tools, your rehabilitation toolkit. And this is where I come up with the 4 pillars, right? So I have a patient in front of me, and of the tools at my disposal, I can put them mostly into 4 categories. So number 1 is I can look at my manual therapy, right? So I can look at is this a case where I can do some mobilizations, range of motion, stretching, any of your myofascial techniques, anything that is your hands-on tools for moving soft tissue or joints. Okay, so that falls into your manual therapy category. Okay, then I would also have modalities as another potential tool, right? And whatever I have, is it my laser? Is it my e-stim? Is it my shockwave? Is it ultrasound? I'm going to throw into that category acupuncture, heat or ice, or any of pulsed electromagnetic field. I mean, I could likely just keep going on depending on what you have access to or availability to or have learned to use. So you have got your modalities, things that you use, a machine or a substance that you apply to an animal for whatever kind of physiologic effect that will have to the underlying tissues that you want to treat. So number 2, I'm like, did I forget anything? Good enough. Okay, yeah, TENS, microcurrent. Okay, good enough. So then number 3 if you prefer, okay, this is 3 in def, so that works. 1, 2, 3. 3. Number 3 is going to be your exercise therapies. So your exercise therapies, whatever it is, are you trying to strengthen a certain area? Are you trying to do gait retraining? Are you doing return to sport? Are you working on balance, static balance, dynamic balance, endurance? Okay, are you looking at, I'm going to throw underwater treadmill here or land treadmill. Oh, I got tweakies. There we go. What are you trying to accomplish then? What can exercise accomplish to help? Is exercise something that is helpful in what it is you are looking to achieve? Okay, your goal. Will exercise meet the goal that you are trying to achieve? 4. 4 is going to be your advisement. Okay, is that your home program? Is that your list of do's and don'ts? Is that things like, put yoga mats or around the house, or a mat, a non-slip mat at the bottom of the stairs? Is that don't allow your dog to do stairs? What is it that you need to tell? How long should they be exercising? What can they absolutely not do? No, they can't play with the other dogs in the house. No, lock up your children. They're horrible for dogs. Okay, is it something like that? Is it your return to sport? Is it that they need to seek further diagnostics? Okay, all of that is advisement, things that you know in your head and you say out loud to the client to help the dog. So those are my 4. And of course, now you're going to come up with other weird and wonderful things, right? Like, okay, well, bracing or adaptive aids or wound care. And so those can go into a miscellaneous category. So I guess, we won't cut off our thumb. That can be number 5 is miscellaneous other things. But essentially, these 4 things are things that you would have at your disposal for just about any patient, right? Manual therapy, modalities, exercise, and advisement. Those are your 4 things that likely every patient that comes into you, those are part of your toolkit that you can apply. And while part of me is like, oh my gosh, this is horrible to distill it down to, this is like the most dumbed down version of what is rehab. But it is also quite helpful if you are either new to it or new to it, a vet coming in and rehab is new, or new to it, you're a PT or a physio coming in and you're like overwhelmed because suddenly your patient has fur. These are the roots. This distills it down to kind of your just most basics that you're like, okay, chill out. Here's how I can think about this. Instead of like, oh my gosh, I got all these things. Think about your categories. Where does this fit? What is going to achieve the goal you want to achieve? And here are it's your spice cupboard. Picking out a little bit of this. Okay? So that is it. And look at this cool shirt. I got it on Etsy. Alrighty. Until next time. Cheers.